Okay, I think it started recording now. So this focus group has been recorded by the 0 to 19 service for Northamptonshire Healthcare NHS Foundation Trust. We're the universal part of children's health services. That means that we're available to everyone of 0 to 19 years of age, including all pregnant women, babies, toddlers, preschool and school-aged children, including children who are home educated or not in a formal education setting. Children who attend special school have a special school nurse whose skill set is more specifically attuned to their needs. The Universal 0 to 19 service is a public health nursing service and it's made up of skill mixed teams. Our teams include health visitors and school nurses who are trained as specialist public health nurses as well as being qualified as a nurse or a midwife. We've got community staff nurses who are qualified nurses and have a range of backgrounds, including children's nursing, learning difficulties, mental health, and general nursing. We've got community nursery nurses who are experienced and qualified nursery nurses who have got particular skills around assessing and supporting child development. And our school nurse assistants have got a range of different backgrounds and they deliver the majority of our school screening programmes like height and weight assessments. We're commissioned to deliver a range of mandated contacts at antenatal, new birth, 6 to 8 weeks, 8 to 12 months, 2 to 2.5 years at school entry and at year 6. Our mandated contacts, alongside family self-referrals to our service and referrals from other agencies, provide us with the opportunity to identify health needs. Our core role is to identify needs, to support children and families to access support and early intervention to meet those needs, to facilitate or provide that early intervention when the need is a health need, and to safeguard children and young people. There's clearly a really strong link for us between our core role and early help. So at the early help strategy, a set a priority to develop a simplified early help assessment tool to ensure that all families receive the right help from the right person at the right time. So I've asked some of my colleagues to get together today so we can ask a few questions about that. So why is early help so important to families? Go on, Claire.
Hi, I'm Claire. I'm a community nursery nurse. I think that the early help is important to families because it is often their first opportunity to really tell their story to a professional, and hopefully if that professional captures their story, it then saves the family having to repeat it numerous times to all the other professionals that may need to get involved.
Sarah?
Hello, I'm Sarah Welsh, health visitor. I think early help is crucial, really. We're in a very privileged position to see all families universally and see families when needs are emerging, and we can interact with those families and be involved prior to something becoming a crisis.
Jan?
Hi, I'm Jan Foden. I'm a health visitor based at Western Fayville. Early help, we work with families quite closely, and we usually can get to know the family quite well. So we have an insight into their needs and able to direct them to services within the community. So early help will allow us to come together as a team to help identify those actual needs and work with the family to help support them.
Yeah. Sarah?
Yeah, and I second that actually with Jan in the fact that part of our role is around identifying health needs, and often families are not aware that they have a health need, and sometimes through those conversations and those early conversations we can help them to identify what stresses and what needs families have and what support they may need from a range of services, not just health.
Agree. Claire?
I think as well it's really important that the whole family can be part of an early help. It's not just about the child who is perhaps having a particular difficulty at that moment. It could be that there are siblings that need support, it could be that a parent needs support, and the early help assessment helps to identify those needs.
Absolutely agree. For me, early help's really important because it should be early. It should stop families from hitting a crisis point. And there's lots of different things that can trigger difficulties within families. But if we can support at an early point and reduce the trauma for the children and the adults, it's got to be a huge bonus to everybody. So if we move on to the next question, what difference does the right help, right person or right time really make? Sarah.
I think it's critical, isn't it? I mean, from a health visiting point of view, we meet up with families antenatally, so we can really have them in-depth conversations through our antenatal promotional guide conversations with families to identify if there are any needs that family has that may adversely affect their parenting. We know about ACEs and the adverse childhood experiences. We can identify whether 1, 2, 3 of those exist with a family, and we can have that conversation, guided conversation, because it's not just about what we identify, it's about what the family feel are their needs and what support that they might need. And we're really integrated with communities, and a lot of support comes from communities, and we can be that link between a family and what's available within the community for them.
Absolutely. Claire.
As a 0 to 19 team, as we are now, we're really well placed to work together with other services in the community, because as Sarah was saying, you know, we've got health visitors that work with the antenatal families right through to our school nurse colleagues who are working with the teenagers, you know, up to 19. And as a community nursery nurse, I think I'm really well placed to kind of bridge the two elements of the service.
Yeah, absolutely. Jan.
Like I've said before, we often work quite closely with the families, so we can sometimes recognise when a family may be starting to go into a little bit of a crisis. For an example, if we see them at new birth and then we go back in and see them at the 6 weeks, and if we recognise that there may be some emotional health that they may be experiencing, or there could be other issues going on within the family, we're in a position to actually recognise that and maybe even point these out to the family, because sometimes they're not actually recognising the issues themselves.
Yeah, I agree. Claire.
Often I work predominantly with the school age children, and often it will be a school colleague who recognises that there is a difficulty, because they are the ones that spend most time with the children. But because we have good links with those schools, it really helps us to be able to build that relationship with the family as well then.
Absolutely. Sarah.
And I think I can second that, because I think the correct relationship with families, because the question was the right help, and it has to be the right help for the family. It's not about what we see as their need. This needs to be a partnership with the family to be able to identify what is the correct interventions and support that they require.
Yeah, absolutely. I think one of the massive benefits of early help is that it really empowers the family, doesn't it? And the family's got a leadership role within early help, and they've got it's their voice, the child's own voice, the family's own voice, and that the action plan is targeted to meet the priorities of the family and the children, and not the priorities of the professionals that are involved. I think Jan and Claire, you've both got your hands up. Which one wants to go first?
I was just going to say that I think that the voluntary part of the early help is so important, because it's the family, it's giving them the ownership, I suppose, and they're able to identify what they need. It's not somebody else coming in and telling them what they need to have or what needs to change. Sometimes you may need to give them that advice, but it's done with them, not to them.
Absolutely. Should we move on to the next question? So how do you think a simplified early help assessment might make it easier to get the right help from the right person at the right time? Jan?
The early help assessment at the moment can be quite long. It does need to be a little bit shorter, and I think there's a lot of repetition within the assessment form as well. So I think we need to look at it and looking at how we can try and make sure that we identify all needs within the family and the family to identify them themselves, but also just to make it that little bit shorter, and for the family to understand it, because some of the questions that we're running through on the form, I have to say, people have looked at me and parents have looked at me before as if to say, really, what? So yeah, it would be really good just to make it more for parents to understand and to work with it.
Have you got any specific examples, Jan, of the questions that families find it more difficult to answer there?
So there are some of the questions, I mean, it identifies all different areas within the family. And there's, there are times that I've had on one assessment where the family, there was financial difficulties, but the family actually didn't want to admit that to themselves, and also were scared also to say, actually, yes, we are in hardship at the moment. So it was a really good question, because it's something that I hadn't discussed with the parents prior to the assessment. So it was highlighted, but yeah, it needs to be in there. All the questions need to be in there still. It's just making it more simplified and for the parents to understand.
And it's that partnership approach of answering it as well, isn't it? And it's giving parents the right to not answer some stuff at this moment, but to be able to come back and talk about it, and to have that opportunity to reflect that perhaps this is something which might be influencing the amount of stress in our household at the moment. We might not be ready to deal with it today, but maybe we'll mull it over and come back to you for a discussion in the future. And it's that relationship between you as the practitioner and the family, isn't it? And that the kind of openness and honesty and respect for each other.
Yeah,
I think that's one of the things that I really like about doing the actual assessment, is that you get to ask questions. It's almost giving you permission to ask uncomfortable questions sometimes, because you're giving the family the opportunity to think about what may be the underlying cause of some of the difficulties they're experiencing. And like you said, Pippa, if they don't want to talk about it at that very moment, you've still kind of planted that seed in their head that they may at some point come back to you and say, well, actually, I know I didn't tell you at the time, but, and then give you some more information.
Sounds like you use it as a bit of like an aid or a tool for professional curiosity and opening up questions and thoughts with families.
Absolutely. But I think, like Jan said, the actual form filling itself can be quite daunting and time consuming. So if it could be simplified in some way, that would be really helpful.
It sounds like you need a detailed tool, but a simplified form that you put the answers onto.
Yeah, that could be helpful.
Yeah, and that really does come out, I think, when you do your action plan. So you do end up with quite an in-depth amount of information from your early help assessment. And then when you're drawing it out to put on your action plan to move forward with the family, you can draw that out. But I think the form, it could almost be a shorter form and bigger guidance to be able to maybe fill the form out. And I think the other area is around conversations we've had with colleagues, is around identifying needs, but having the services available then to meet those needs, because it could be quite disappointing for families if you identify lots of needs, but then don't have a solution or an idea of where you're going to go to be able to get a solution or some support for the need that you've identified. And I'm sure that the resources are out there, but for practitioners, it's about having a better directory or a better central access point to know, if I've identified a need within this area, what services are there that I can talk to get some advice or refer the family onto.
Claire?
Yeah, I totally agree with you, Sarah, but I think sometimes just that containment that the family get from somebody hearing them can help as much as being signposted to another agency. So I think that's a really key role for us.
Jan?
The early help team have been really good in the past. So I have felt that when there are needs there, that I have been thinking, how are we going to try and meet these needs? To go through to the early help team, they have been really beneficial. They've come back and they've been really helpful and directed myself and my colleagues into where the services are.
Have you all had contact with the locality connectors as well? They are an amazing source of knowledge and know so much about the different services, not just the services that you might be referred to for an intervention, but actually what's available in the community for that general boost to self-esteem for children. There's that opportunity to talk to another parent through that group. It's a bit tricky at the moment with COVID, but there are still things out there, and the locality connectors are really good at helping you to find what might support a family.
Yeah, I agree. I agree that if you need support, they're there for you and will signpost you.
Jan, did you have another thought?
Yeah, just an example of that, Pippa, is I recently went through to the early help team, and they came back stating, actually within probably about 10 minutes, that there was going to be a meeting held in one of the local centres, which happens apparently every month, which is they look at the support that's needed within that area. So she was going to take the case straight to them on that morning to see what would be available within that community to help a family.
Oh, that's really helpful, isn't it?
It's really good.
So, have you got any other thoughts or wishes about the early help process? I'm going to get you started. So for me, I wish we could do it earlier, and I kind of see it as an escalator, and I think sometimes we're trying to grab people who are halfway up an escalator and drag them back down again, and actually what we need to do is help people not to step on it, or get them off the first step instead of halfway up. And I think it's really difficult because sometimes the time at which families are ready to engage with us might be when they've hit a bit of a crisis point, and that might suggest they're already further up that escalator. But if we intervene earlier, I believe we could be more effective and we could be briefer with our interventions, which would save resources across the whole of the partnership, because we'd be able to intervene quicker and more effectively. How we do it is a different matter, so I wonder if you've got any ideas about that. Claire?
I think one of the barriers is that other agencies that we work with aren't necessarily keen to lead the EHA. You mentioned that you think an EHA might be useful for this family, and you can almost see them rolling their eyes. So there is some sort of barrier to EHA. We need to come up with a strategy to help people see it as a positive.
Do you think you can identify what the barrier is, or any of the barriers?
I guess probably part of it is the paperwork and the organisation of trying to coordinate people's diaries to attend meetings. But then, having said that, virtual world that we're all living in now, it is perhaps a little easier to get people together virtually.
Sarah, have you got a thought?
Yeah, I was thinking, you were saying about getting in early. So we know from a single agency approach, we would do our early intervention, we would do our emotional coaching and our work with families around allowing them to be able to identify and manage, and like you say, take responsibility for their own needs. And we're really lucky in our skill mix that we've got our nursery nurses to help support any short-term interventions, and we will do short-term interventions around maternal mental health and behaviour. And we have our colleagues in Strong Star and in the perinatal mental health team that will support us from that sort of early partnership working. But I think it's true, I suppose, that if we're identifying early on, 18 months, 2 years within a family, some issues, that maybe we have a stronger approach to early help then than maybe allow those issues to carry on and come out in a primary school setting later on. So I think it is probably about us as well being more tuned in to has the problem resolved, have the family engaged, are they understanding of their needs and around that sort of parenting and dynamics of the family and how that supports moving forward, and using that early intervention, that community level support that we have as well, to make sure that families have a lot more resilience because they've got a lot more support wrapped around them in them earlier years probably.
Good point, Sarah. There's something about where early help sits for me, and that early help sitting on the safeguarding agenda might almost stigmatise it a little bit and create a barrier for us to intervene earlier using the process. So if we were to say to a parent around behaviour with a little one, or some sort of emerging needs with a sort of 2-year-old, that we might suggest an early help assessment process and bring in some agencies together to support early on, that they might, if they understood that it's sat on a safeguarding pathway, would they find that more difficult to accept than if they thought that we just were working with a health visitor. So for me, there's something about like realigning early help as part of a more holistic wellbeing pathway, and how we communicate and advertise about it to families and to professionals, so that we're all more keen to participate in early help earlier on. Takes away some of the stigma, maybe.
Yeah,
I agree, because I think a lot of the recommendations for early help probably come through to us from MASH referrals. So you're already approaching from a family that's already in crisis or definitely getting towards crisis. And like you say, there's that stigma already that there's probably a safeguarding feel or element to it, as where if it's more around a supportive approach and we're looking at family emotional well-being, then they would probably be more likely to engage, because you've built up that therapeutic relationship and you've had those conversations with family around tailored approaches from services to meet their needs and what they feel are their needs.
I think if there was more promotion and advertising of early help, or early help assessments even, but maybe assessment is the wrong word to use in an early setting, because people may be put off by the thought that a professional is assessing them. It's more about the early help side of things, isn't it? And I think if we could promote that more, people may be more willing to come forward.
Lovely. So we can probably summarise what we've said. I think we've talked about how we believe early help's really important. We want to intervene earlier. We want to work with families at an earlier point of need. We believe that we can be more effective and make a bigger difference then. We hope that a slight change to the process to simplify it will actually really help with that, getting the right help from the right people at the right time. And for us, some of the barriers might be around the fact that it sits on a safeguarding pathway at the moment, and some of the language or the way it's sold to families might not be as attractive as if we sat it on a wellbeing pathway and made it more accessible to families. So I'm really grateful, Claire, Sarah and Jan, that you participated in this conversation. Thank you very much.
thank you.
I don't know how to stop it. Stop it.